as we see more infections in the community, it's important for us to do more testing in the workplace to allow us to safely participate in more activities in the community and at home. And we've made ART test kits widely available to the public, whether through the community pharmacies and selected supermarkets, through the home deliveries to every household, through the workplace, in cooperation with the employers who have also provided test kits for employees to perform routine regular testing. Today, we're announcing the deployment of 100 vending machines across the island in 56 locations. And these vending machines further provide individuals who have been issued with health risk warnings or health risk alerts with the opportunity to get test kits at any time of the day from tomorrow. If you are symptomatic and have fever, respiratory symptoms, or loss of smell and taste, we continue to strongly encourage you to attend at a SASH clinic where your family doctor may perform a PCR test on you to exclude COVID-19 infection. And while awaiting a test result, we ask that you return home and self-isolate. It is important that you do not continue to work or to further engage in social activities coming into contact with other people. And this will help to avoid further spread of COVID-19 to other people, particularly your loved ones who may be vulnerable. And even if the test result were negative, but you remain symptomatic, it is likely that you may have other infections which also can easily spread to them, making them sick. So you should still continue to isolate yourself until you recover from your infection. And if you're diagnosed to have COVID-19 infection, we will assess you further to determine whether you can safely recover at home in self-isolation. And this will be the default recovery setting for most people, and we expect that up to 70% of infected people who are relatively well or mildly symptomatic will be able to safely isolate and recover at home. There are others who are unable to safely do so, or those who have risk factors which benefit from closer monitoring. And these individuals may then recover in the community care facilities or CCF or in the hospital. We have published a guide earlier in the week to explain what to do if your PCR test is positive and the options for recovery, particularly at home. But for those of you who are asymptomatic and who have performed an ART test and that test result is positive, please do not continue to go to work or continue your social activities. What is important is that you must isolate yourself from others at this time. And this is the socially responsible thing to do in the event that you're really infected, to protect others from being infected themselves. There is no need to rush to a hospital emergency department to get yourself tested. And where there's any concerns, you may go to one of our SASH clinics where a GP is able to assess you further and decide on the necessity to perform a PCR diagnostic test for you. In fact, if you rush to the hospital A&E department, you may inadvertently expose yourself to more risk because there may be other infected people present in the hospital. So if you have a positive ART test and you are able to self-isolate, we encourage you then to stay at home for at least 72 hours. And that allows you then to safely recover during that period of time, monitoring your own health, and not then spreading infection potentially to any other people. At the end of the at the end of that 72 hours, we would encourage you to do another ART test. And if your second ART test is now negative, you can then have the peace of mind knowing that you have recovered from your infection, and then you can progressively resume your normal activities, going back to work and going back to social activities as well. If, on the other hand, you're unwell at any time during this period of self-isolation, please visit your GP as soon as possible so that your GP can reassess you and, if needed, perform a PCR test to clarify your status and your situation. And he will then give you further advice on what to do next. What we want to do through this modified new regime of self-isolation is to give you the empowerment to be able to take charge of your health, and particularly if you're asymptomatic, to allow you to continue as much of your activities in the community as is safely possible without exposing other members in your household, your friends, your colleagues, and other members of the community to any risk of infection. At this time, with the rising number of cases in the community, as the Minister has stated, I encourage you too to minimize your social activities in the community. Work from home as far as is possible. If you've tested positive, self-isolation is the most important measure that you can take to protect your loved ones. And you have not vaccinated yet, please register for vaccination. If you're eligible for a booster dose, please register for your booster vaccination injection. And we can all each do our part to fight against COVID-19. But that first part, that first step, must come from our willingness to do our bit, to test, to isolate ourselves, and to vaccinate. Minister.
Thank you. So even as our infections are still rising rapidly, we can all play our part to determine the trajectory of the infection curve. We are not the first country to have gone through this baptism of fire and will not be the last, but our position is different because we are more than 80% vaccinated. In fact, 85% is now have done their first shot, which eventually means we will have 85% of our population vaccinated. And we are not completely helpless to determine how the situation will unfold. We can all do our part, and with collective effort and will, we can overcome this right through this transmission wave while keeping the number of serious illnesses and deaths as low as possible.